screening, just to summarize a little bit. Screening, some of the main focuses are remembering to evaluate, that you are evaluating psychological, social, legal, family history. You gathering information. That is very important, okay, for test purposes. Also, the appropriateness. You know, we're looking at appropriateness for the program. You're looking at, you know, whether they need detox, inpatient treatment, residential, or even a day program, which may mean CCAAD or hospitalization or facility base. So just keep that in mind. And eligibility is the part where it focuses on the finances piece. You know, can they afford it? Are they from this catchment area? You know, just looking at the target population as well. You know, if you're a male facility, do you serve females? You know, just keeping all those types of things in mind. And then when looking at coexisting conditions, because that's important too, because today you know that we are dealing with a lot of mental health issues and substance abuse. You know, they're coinciding together, and so you really want to be aware. And a lot of people have health problems, you know, with high risk behaviors going on. You really want to be aware of coexisting conditions and that they do exist, and be aware of some of the resources that may be available. That's just for your own, to have that knowledge and that skills. You want to be able to show competency in this area. Also remembering the laws and the regulations, agency policy, and we talked about what governs substance abuse problems. The CR 42 is very important. Just to summarize, some of these information is going to be on the test. So you want to be able to show understanding and competency in this area. Okay, I would like to just summarize what I talked about, intake. Because intake, it has 3 global criteria. And this is just a clue right here. When looking at these 12 core functions, some of them may have 2 global criteria, some of them may have 5, some of them may have 6. If they have 5, you can rest assured that a lot of the questions is going to be in that area. Intake, you may only have maybe 1 or 2 questions in reference to intake, because intake is only talking about the required documents that needs to be signed by you and the client. Not just signed, they need to be explained. You want to make sure that the client have a clear understanding about the document that he is signing. You want to talk about the importance of, you want to think about the importance of the consent forms that need to inform consents. Now there's some agencies have informed consents where they can gather information. If you have one that gathers information, you want to have one to be able to release information too. You know, that give and take situation. So you want to make sure that, because there's a difference between just having a client sign just an informed consent. It needs to be plain as to inform and to receive, or just to receive and to inform. And you want to make sure that the client is not checking all the boxes on there, because some of that information you don't even have, and some of that information you don't even need. So just make sure that intake is a process of completing documents, having clients sign his agreements that he's going to participate in the program, what he's going to pay for services. Just keep that in mind. Showing competency is the main key to being able to pass the exam. I'll see you doing next session.